Is Riley Mathis, and I will be presenting to you the US and the UK healthcare systems. Alright, so before we actually dive into the material itself, I want to give a brief overview of what we'll actually be talking about. So first we'll look at the US healthcare system and kind of what entails each insurance type here. Then we'll look at the UK healthcare system and how money flows from person back to their healthcare. Then we'll look at measures of health that will pertain to both the US and UK, of course. Then we'll look at the limitations and improvements that could be made by each type of healthcare system. Alrighty, let's start with the US. So as we know, the US does not have universal healthcare coverage. We are classified as a system who uses many models, making us a mixed system. We have aspects of both universal coverage and private coverage. Now, when looking at healthcare, there are three key aspects to focus on: cost, quality, and access. In the US, we're really big spenders, so we have a high cost. We tend to have a poor to average quality and a poor to average access. Depends on where you are in the country. Average to poor quality refers to the quality of care and equipment used. Sometimes we have high-tech materials in urbanized areas like big cities, but in the rural areas, we're not going to have anything. And we also tend to have staff shortages in certain areas, which increases wait times, which again lowers the quality of care. Poor to average access means not everyone has access to healthcare. Some are uninsured and cannot afford to go to the hospital, while others just simply live too far away from a decent hospital. All three of these key aspects are influenced by many factors such as race, ethnicity, gender, sexuality, social class, or even citizenship status. All of these key aspects that we have do not create the best healthcare system. We have many issues, but we'll look more into those later. Overall, we saw about 27 million people who were uninsured in the US in 2021. There was an effort in 2015 to bring a form of universal coverage to the US. This was done under Obama's presidency, and it was called the Affordable Care Act, or the ACA. 20 million people gained insurance under that act. This piece of legislation is no longer what it was due to the changing of presidents, but it still worked to show that we can do a lot of things to lower the uninsured rate here and just change things within our healthcare system. Within the US, there's a lot of tension when it comes to the subject of healthcare. Many believe we should have universal healthcare, while others just genuinely hate that idea. So there's just this big divide when it comes to healthcare, so it really makes it hard to have advancements in this sector. So hopefully, when people start to look more into healthcares and what makes them, we can make better choices. And so this is just a brief overview and rundown of the American healthcare system. In the next slide, we're going to look more into how Americans actually get insurance. As I said before, there's two types of healthcare coverage here in the US: private and public. The public healthcare coverage is paid for by either the government or us taxpayers, and that includes Medicaid, Medicare, and the Veterans Administration. Those are at least the big three, and we're going to focus more on Medicaid and Medicare. So looking at Medicare first, those who qualify for Medicare are the disabled and the elderly. There are three parts involved: Part A, Part B, and Part D. You do not have to sign up for all parts, but each part will give you a different benefit. Part A covers the inpatient care within places like hospitals, nursing homes, or hospice care. Part B covers the outpatient care, medical equipment, and preventative services you may need. Part D will cover the cost of prescription drugs. So there's two options to choose from when signing up for Medicare. You can either do Original Medicare or Medicare Advantage. Original Medicare includes Part A and Part B, and Medicare Advantage will include Part A, Part B, and Part D. So essentially, it's either you want just the services or services plus prescription drugs. That's kind of the rundown of Medicare, sorry. So now looking at Medicaid, those who qualify for Medicaid are the people who have extremely low incomes and fall under a certain income bracket. There are different types of healthcares offered for Medicaid, but they vary by state. But here in Indiana, most packages of Medicaid practically cover everything you might need. This includes hospital care, doctor's visits, prescription drugs, dental care, mental health care, vision care, hospice care, and there's a lot more. Moving on to more of the private spending, this is where things could vary a bit more. Private healthcare is paid by you or partially by your employer. You can get healthcare insurance by a variety of carriers. Some examples would be like Blue Cross Blue Shield and Progressive. There's many parts that go into private healthcare insurance. You pay a premium each month to your insurance company. Then you pay a deductible each time you use a healthcare service before any insurance money will kick in. You will also have copay, which is what your provider will make you pay to your healthcare provider every single time you receive a service. Then you also have an out-of-pocket maximum, and this is the maximum amount of money you must spend until your health insurance will cover 100% of the medical costs. It's really crazy to see how much money you spend on healthcare, on healthcare insurance. You may not even be going to the doctor, but you're spending all this money each year on yourself without even realizing it. But this is kind of just the rundown of the US healthcare and the insurance. So now on the next slide, we're going to be looking and focusing on the UK healthcare system. All right, next let's move on to the UK's healthcare system. Now, specifically, we're going to be looking at England's, and it's very different from the US's. It is called the National Health Service, and they follow the Beveridge model, which was established in 1948 by Sir William Beveridge. In this system, the government finds the funds for healthcare. This is done through tax payments, and because of this system, the Brits would never receive a doctor's bill when they enter the doctor's office. And this also means that some of the doctors here are considered government employees as they're paid directly by the government. There are still private doctors in this system, and around 10.5% of the population has private health insurance. But this also means 90% of the population there still relies on their free health care. The NHS covers a variety of services. You've got things like preventative services, hospital care, dental care, eye care, mental health care, and plenty more things. When buying prescription drugs, the people who live there will have to pay a copay of £8.8, but compared to here in the US, that's not too bad. I just paid $20 for some eye drops and amoxicillin. They just pay £8.8 for anything, which is pretty crazy to me. Now, looking at cost, quality, and access, we can see why the system differs so greatly from the US. There's low cost here in the UK as the citizens don't pay anything to go to the doctor. They pay taxes, but nothing physically out of pocket once they enter that doctor's office or that GP's office, wherever they're going. And the government gets to choose where money goes. So they choose if they want to spend a lot, spend a little. That messes with the cost aspect. There is average quality, somewhat like the US's. There's high wait times and staff shortages. And there is high access, as you can go receive health care anytime, essentially. There is a shortages of doctors, like I mentioned, which obviously affects the system and its balance. If people cannot get their services, then they will get mad that you charge them a high tax rate for nothing. So when people go to med school, and I find this part really interesting, the government pays for all of their school fees. I assume this allows for people to study without the burden of crippling debt, which sounds amazing, and I think that truly conveys a huge difference between us and how the UK values their medical students. Next, we are going to be looking at how money flows throughout the NHS. Alright, so now we'll talk about the flow of money. Now, this diagram may be a bit of an eyesore, but it does get the job done. So, the government is the body that owns the NHS, but there's still other people who play important roles. There is a Secretary of State for Health and Social Care that is appointed to help divvy up the work. So it's not just this big head group of NHS. There's people below it. And the Secretary of State deals with public health, health policies, and other health-related items. Besides the people involved, we'll focus more on the money flow now. So obviously we're going to start on the left with the taxpayers. And starts with the taxes paid by the citizens who live there. Then those taxes are funneled down to the Department of Health and Social Care. Most of the money is then sent down to the next group in the chain, but the Department of Health and Social Care may use some of the funds to help with the regulation of public health. They could request reforms, training periods, or new legislation with this money. Next in the chain is NHS England. This group bases everything off the NHS mandate. This mandate describes what needs to be focused on and achieved in the healthcare world. So, NHS England focuses more on specialized care, and it does not focus on general practice. None of that. So, they do not deal with just your regular doctors. Next in the line, we have the Clinical Commissioner Group. This is where we see aspects of healthcare being applied more generally to households. This part of the chain helps to coordinate the correct health services for patients signed up with the NHS. Finally, we end with the service provider, or healthcare hospital provider, and that's where we see this money flow chart end. These are the places that provide healthcare services, like hospitals and private services. This would include your doctors, your nurses, your EMTs, or your long-term care providers. So overall, with this flow of money, we can kind of see that the money comes straight from a person's pocket and then goes straight back to them. It may take a little while to flow through this, but they somehow end up getting their money back. Now we're going to be looking at the measures of health. So the first one we're going to look at is health spending. Essentially, how much money does a person spend on their healthcare each year? So in 2021, the average spending for a person in the United States was almost $13,000, which is a crazy amount of money to be spending on your health. Now, mind you, it's an average. So I didn't really spend anything on my healthcare, but there are people who are spending $100,000 on theirs. So when you average this out, it makes it still seem like we're paying a huge amount of money. Now, compared to the United Kingdom, where they're paying a little over $5,000 a person, we're spending over double than they are. And they're still paying these crazy amounts in taxes, quote unquote, like compared to us here in America. And it's just crazy to see that they spend such a smaller amount than us, yet you'll see in future slides that us spending this crazy amount of money might not actually be benefiting us, and we might just be paying into a system that doesn't provide. In the UK, it's a little different. They're not paying nearly as much, and things are actually being outputted. They're seeing decent health results compared to us here in the US. Now we're going to focus on life expectancy. So keep in mind how much money the US and the UK spend. UK down here, US all the way up here. Now we can see US on that good old red line with a lower life expectancy, even though we have that high, crazy amount of money being spent. And then now somewhere in that jumble of gray lines, you'll see the UK kind of down by the bottom in the middle. They're sitting at over 81 years, but spending not nearly as much as we are. So their life expectancy is higher than ours, and they're spending less money to achieve that. That's just showing somehow in the US we're spending crazy amounts of money, and it's not being reflected. Where is this money going? What is it doing for our health? Because it's not improving how long we live. So what is it improving exactly? At least for the UK, the money they're spending kind of reflects, oh, we have a decent life expectancy, not super low, not super high. It's doing something. But in the US, it's not showing that. Here, we are looking at the maternal mortality rate, essentially the rate of mothers dying after giving birth. We can see that it is about 23.8 deaths per 100,000 live births, which is sad to think about. It may not seem like a crazy high number, but that's still people dying. In the UK, it's about 6.5 deaths per 100,000 births, live births. Which, on this graph, the UK is only the fourth one down, but that's almost triple or quadruple at that point. It's like about triple. The US has tripled what the UK is. And again, we're spending all this money, but why are our mothers dying? Why are pregnant people dying after giving birth at higher rates compared to people in other countries? The UK's could be lower, like other countries are. It's not, so something still needs to be done. Maybe they need to increase their spending. I don't entirely know, because I do not live there, obviously. But that's something that could be looked into. Do they need to spend more money to lower this rate? But their rate is lowered compared to ours, at least. So they are doing something right, clearly. What it is exactly that's helping them, who knows? But the US, that is a high rate, does not need to be that high. We may have a higher population, but still, we can lower that. We should not be having that many people die when we're spending all that money. Now we're going to focus on the limitations associated with each system. We're going to look at the UK first, and looking from a doctoral perspective, you're not making as much money as you could. Here in the US, people want to be doctors because they're going to make $200,000, $300,000, $400,000 a year. In the UK, you're being paid by the government. They're not going to pay you that much money. And these doctors also have to deal with a really high volume of patients. And another downside for the citizens is that they have to pay a really high rate of taxes. Basic income tax is 20%. And if you make more than £50,000, your income rate increases to 40%. That can be hard for some to make a living if almost half your paycheck is going towards taxes. Another issue we see is that's going to be hard to keep down wait times. People should not be afraid to go to the doctor here, as there's no financial burden, so many will attempt to go to the doctor whenever they need to. Unfortunately, the percentage of people who have waited over 12 hours between decision and admission into a service has increased by 44% by the end of 2022, meaning a lot of people are waiting a really long time. And these wait times will cause British locals to avoid going to the doctor because they don't want to wait a ridiculous time, which we also do not want. So now looking at the US, as we saw in the previous figure in the measures of health, the average American spends around $12,914 just for healthcare. This can severely economically impact somebody. There are people who are hundreds of thousands of dollars in medical debt and have no way to pay for that. It's just a crazy amount of money to spend on something. And for some people, all they pay for is insurance, and they don't actually even visit a hospital. Moving away from the money, though, there is poor access around the country. Around 30 million Americans don't have insurance, so it's really hard for them to go to the doctor without that financial burden. And nobody wants to go when they're going to pay $10,000 afterwards for something simple. Some people live in rural areas and live miles away from the nearest doctor or even fire station or police station, so it makes it hard to get proper medical care. Another downside to the American healthcare system is that the government's involved, almost too involved, in the sense that many government officials are not qualified in medicine. They're not doctors, so they're making decisions about healthcare without truly knowing what they're doing. It's really harmful to our system because we're a combination of systems. They're affecting different portions in different ways. We're not just one system, so it won't affect it in just one way. We're multiple systems put together, so it's going to have differing effects. And without doctors and medical professionals being able to properly voice their opinion or their professional medical opinion to the government, millions of people go without care and go without proper care. That's kind of the downsides I see with each system. Now we're going to look more into how these can be improved. Alright, now we're going to look at the improvements that can be made. We're going to focus with the UK first, and they severely need to improve their wait times. Lowering the wait times in hospitals or healthcare centers will increase patient morale overall. These hospitals desperately need doctors, and the system can only be improved when they have the right amount of staff. Doctor and nurse morale will increase if these places are fully staffed. They already have started to improve these sectors by paying for student medical school, like I talked about earlier. Costs do not seem to be much of an issue in this healthcare system, so I don't believe there need to be many changes made in that sector. Now, the government may need to change and update where they allocate money. If the population is getting older, but all the healthcare funds seem to go towards general population, then they might start to see issues. So I would say that they might need to improve the systems that choose where money goes, like that mandate in the money flow chart. Now, looking at the US has so many things it can improve on, and it's basically because we're a mashup of many systems, and sometimes that just doesn't work. We do need to lower our uninsured rate and our high medical costs Doing both things will improve the thoughts about going to the doctor, and many people in the US refuse to go to the doctor because they're uninsured and do not have money. So, if we release plans that allowed more people to be covered and allocate more government funds to our health-related items or policies, then we may see people use hospitals and general practitioner offices more. We also need to improve the quality of care given. There are far too many times where people leave the doctor's office or hospital unsatisfied. Maybe they were given the wrong prescription or just given poor care. We tend to see that certain races, genders, or sexes or sexualities were treated differently or unfairly, and that just shouldn't be happening. We need to extend quality care and improve the care given to just the overall general population. Lastly, the US needs to change who determines rules regarding healthcare. Here in the US, government officials with no healthcare background are making rules about bodies and procedures. They may not have truly understand the subject they're talking about, and this just doesn't help. We must improve either the qualifications of government officials or get actual doctors to comment on healthcare legislation. With that, this presentation is over. Today I talked to you about the US healthcare system, the UK healthcare system, and some measures of health, and what each country can do better. It is nice to be able to sit down and compare one country to another. Many people want to just look at the good things the US does and refuse to acknowledge what we can do to change it. I don't want to be like those people. I want America to look at other countries and be able to take notes. We need to continue to evolve, and doing something as simple as a PowerPoint presentation gets you one step closer to understanding why we need change. Hopefully, the rest of the world will follow suit.